I'm going to get started here if everybody's okay with that. I'm Gina Orr, Chief Philanthropy Officer, Sun Health Foundation. And with your little baklava, Joyce and our team delivered this little card. And so I wanted to talk with you just a minute about the card. So the back of it says time for a refill. If you missed the last coffee with Gina, please visit our video library, and it gives you the link to that you can, or the pathway to that you can type in, or you can take your phone and take a picture of this little code that's on the back too, and it takes you right there. We invite you to share this with your friends so others can come into, they can zoom into our Coffee with Gina and Friends. I know many of you are involved in many different groups. All of you are very active, and this is a great way to share this information with others as we expand Coffee with Gina and Friends. As you know, we've been in the midst of this very large campaign, and so initially this was a little more of a focused and targeted tactic for us to have conversations about topics, and we're at the point now where we're going to be expanding that quite a bit. So please take this little card and pass it to your PEO sisters, or at church, or where you might volunteer, or golf, or play mahjong, or whatever you might do. This is a great way to help others access these important topics. So with that, I'm going to get going with Adan here, Adan Hernandez. You know, this is really a great topic to kick off our first Coffee with Gina and Friends in 2023. And in the spirit of full transparency, Adan met with my husband and me. We had some questions about Medicare because I had a birthday that qualified me to be one of those lucky recipients of Medicare. And Adan was wonderful. He came to John's house, our home in Tempe, and sat with us and walked us through what to consider, how to research. It was tremendously helpful. So Adan, thank you very much for doing that. And I'm signed up, and I even got my first bill. So yeah, so it's official. It's official now. So that's why. So this is really a topic, and I know we've heard a lot about some new products coming out. I think Banner has a new Medicare product, and it's a complicated and complex issue. And Adan has a way of making it very, very simple. So Adan is a Medicare specialist with Health Markets. He is part of a team with a combined total of 50 years of experience in the field. At one time, Adan was employed by Sun Health. He was on our finance team. I think, did you say it was like 2008, maybe, Adan, something like that? So he's a good friend of the foundation. He's a good friend of the organization, and he is a tremendous resource. Just a reminder, this is an interactive presentation, and I know Adan is completely fine with, if you raise your hand with a question as we're going along. I know he came and presented to our team, and so you can imagine, you know, 8 women in the room with Adan, and the poor guy could barely finish a sentence because we had so many questions for him. He was very kind to let us ask those questions. So again, if you have a question, raise your hand. We're all watching the chat room also, so you can type your question in there and we can read that to Adan. So Adan, I'm going to turn this over to you. Joyce is going to drive your slides, and you're not, okay, Adan's going to drive his own slides. So we have kind of a full house here today. Again, thanks to everybody for wanting to stay up to date on these important topics. Hi, Chicky. And so I will mute me, and Adan, you are on.
All right. Thank you for the great introduction, Gina. I'm honored to be able to talk in front of your audience and kind of go over the demystify Medicare and try to explain it in as simple terms, and open to have a open dialogue and see if I can answer any questions that you have. All right, and I'm going to share my screen real quick. Let's see here. All right. All right. Let me know if you can see my screen. All right, awesome. All right. So today's topics, does Medicare give you a headache? All right. And we've got the aspirin. Love it. All right. So I'm going to dive into this presentation. All right, a little bit background about me. I've been 10 years working in healthcare in different capacities in terms of independent living communities, also within the hospital environment. Right now, currently I'm with Health Markets. We're one of the largest distributors of health plans in the United States. We have access to a large network of insurance carriers and from all types of services within Medicare, hospital indemnity, long-term care, and final expense. A little bit about me. I was born and raised in Las Vegas, Nevada, moved to Arizona in 2004. I love hiking, snow skiing, and soccer. I have two beautiful teenagers, Mateo and Marley, and actively involved within their school, and also involved with different communities here and organizations within the Valley. All right. Here's a list of the companies, a sample of some of the companies we represent: Aetna, SureBridge, Securian Financial, Humana, all the major insurance carriers here in the United States. All right, before I get started into the presentation, just to kind of do a brief recap on some of the key terms that are used in Medicare. So beneficiary, that's referred to as an individual covered under Medicare. Premiums, the fixed amount you pay for coverage, usually monthly. And then deductibles is a preset fixed amount you pay before your insurance starts paying. Co-payment and co-insurance, it's a preset fixed amount you pay for each service or product. And then co-insurance, most people, this term usually gets confused with a lot of people, but it's a percentage you pay as your share for services after you pay any deductible. All right. Any other questions? Are we all good? Okay. All right. And when I go over Medicare, I like to talk about original Medicare first, and we're going to dive into Part A. A lot of people aren't familiar with how Part A works. Some people believe you turn 65, you automatically get it. Well, there's eligibility requirements. So one of the requirements you'll see in the left-hand side there, it qualifies based on your work history. How many years you've paid into Social Security? So 10 years, so 40 quarters. Another way you can qualify under your spouse's benefits. And if you haven't accumulated enough history or have paid into the system, you can buy Part A, which right now in 2023, the cost is $506 per month to have Part A. Also, there is some out-of-pocket costs with Part A. For example, for days 1 through 60 in a hospital, you have to pay deductible, which is $1,600. If for any reason you have to stay longer than 60 days to 90 days, there's a $400 per day co-insurance. And if greater than 91 days, it's $800 per day. So that can add up. I mean, depending on your situation, if you were to get ill and had to stay significant time in the hospital, it can be very costly. Also, the skilled nursing has out-of-pocket costs for there. Up to 100 days is covered, coverage. Days 1 through 20, 0 per day. But if you stay 21 days or 100 days in skilled nursing, it's $200 per day. All right. So that just introduces you to the cost, the out-of-pocket expenses related to Part A. Next, I'm going to dive into Part B. Okay. Now that you know hospitalization is covered by Part A, what about Part B? All right. So this is an estimate based on premiums that you pay for Part A, for Part B. And this is the $164.90 for 2023. This covers all of the medical your doctor visits, treatments, outpatient type of procedures, covers all your preventative services. And so you have to pay that premium for Part B to cover those other services. All right. What are some other out-of-pocket costs that you might face? All right. There's the annual deductible of $226 that you have to pay. Also, Medicare only covers 80% of your costs. You have to cover the other 20%. All right. And then there's a a 15% excess charge that a provider can charge up and above what the Medicare rates are. And that depends on, they're allowed to do those adjustments. And so these are examples of some of the expenses that you're responsible for. Okay, and that's just Medicare Part A and Medicare Part B. All right.
Hey, Adon, could I just jump in for a second and share an experience that we had?
Absolutely.
Okay, thank you. So my husband is older. He's been retired for about 10 years, and he has a very good plan through his former employers. You know, he was employed by the county and by the city of Tempe. So they worked something out between the two. It was a United Healthcare product. So I had been on his health insurance. I was thinking that I could just go Part A since I was uninsurance with John. And then I learned that that was not the case because Medicare did not recognize partners insurance if they were retired, which to me made no sense because it was a group plan. It was through the county or the city or whatever. So I had to go in for Part B. I wasn't automatically able to get only Part A. Now that may not apply to some of the people on this call, but I think it's important that we really understand how this works, because I just figured that I would be covered and do Part A only because of John's, and that was not the case. So that's why this is kind of a complicated meandering through the topic. We appreciate your clarifying. Thanks. That was it.
Yes.
Thanks, Don.
Yeah, and in those situations, it depends if you're still working and you're covered by an employer plan. And that's the thing also too, you have to make sure that plan is a qualified health plan, and that so you're eligible, so you're not penalized for not needing to be enrolled into Medicare. And so those are some different things you need to pay attention to. Those transitionings, if you decide to stay longer and start working. All right. Let's see. Also, Medicare won't cover every expense. All right. All right. For example, we have acupuncture. That's not covered by Medicare. Your chiropractic services aren't covered by Medicare. Nursing home, custodial long-term care is not covered by Medicare. Your dental care, your dentures, anything that's not covered by Medicare. Hearing aids, routine vision and glasses aren't covered. Emergency medical care and prescription drugs. All right. And here's a lot to consider. And you're like, whoa, that's a lot to take on. So, extended hospital stay or serious illness could affect your retirement plans, even with Medicare coverage. So these are some of the topics you're thinking about: your premiums, your co-insurance, co-pays, deductibles, and non-covered expenses. Here, I'm going to introduce Medicare supplemental plans. Okay. So if you recall, just on the previous slides, I talked about the deductible in Part A, the daily co-insurance if you're in an extended stay in a hospital. Part B, we have that premium that you pay, which is $164.90. And also we have the deductible as well, and the 20% that you're responsible with Part B. So this is where a Medicare supplemental plan comes in to help cover those expenses. So here on the left-hand side, we have Part A co-insurance, hospital costs. So that's going to cover that deductible and the daily co-insurance in the hospital. We have the Part B co-insurance co-pays. All right, that's that 20%. All right, that's going to pay for in those doctor visits. Blood work up to 3 pints. Hospice co-insurance and co-pays as well. Your skilled nursing facility co-insurance, that was that daily co-insurance rate that we saw after 20 days in a skilled nursing. Your Part A deductible, which is the $1,600, and Part B. Now, the Part B is not covered anymore. If you are a Medicare beneficiary prior to January 2020 and you're able to get on a Plan F, you're very fortunate, because currently after January 2020, that Plan F is no longer available. So right here, Plan G is the one that's the most comprehensive. So as you can see, let me go back. Okay. So as you can see here, Anything that has a check mark, that's where it covers. And you see here, this is the X. You'll still have to pay that deductible Part B, which is a $226. So it covers quite a bit. All right. Now, Medicare Part D, this is prescription drug plans. You'll need to have your enrolled into a Part A and B or Part B to qualify. If you don't register into a Part B or Part D program, you could face a late enrollment penalty. All right. Okay. And there's a couple ways to set these up. You can purchase a standalone plan, or you can include it. It can be part of your Medicare Advantage plan. And deductible usually applies. Each of these plans have a formulary list based on tiers. So, for example, your drugs that are cholesterol, maybe blood pressure medication, antibiotics, those would be on your lower tiers. Anything, for example, a higher end medication might be a cancer-related drug. Those would be on your higher tiers where the deductible would apply. And the drugs plans vary from, some of them have the deductible, and the max allowance for a deductible on a drug plan is $505. And some plans can have a lower deductible. It varies across the board. So that's why, every year during annual enrollment period, you can make those changes to your plans.
And that annual enrollment period is typically when?
October 15th through December 7th. Okay. So you can make changes with your drug plans. If, for example, a certain medication is not part of your formulary. Also, you're starting to see GoodRx is very popular. For example, if a particular drug is not on the formulary, or maybe it saves you more money going outside of your drug plan, that's one way to go about it. But it is recommended to have a drug plan in order to avoid the late enrollment penalty that can be applied.
What does that enrollment penalty look like? Do you know how much it is, or does it depend?
Yeah, and actually, I can go over the details real quick. So how the late enrollment penalty works, or how it's calculated. So if you went 60, so let's say you're going to start Medicare, you decide you're turning 65, you're not going to get a Part D plan. So if you went 63 days or more without a Part D plan or other credible prescription drug coverage after you were first eligible to enroll in a Part D plan, the penalty is 1% for every month that you did not have credible coverage. For example, if you go 14 months without coverage, the penalty is 14%. Then Medicare determines, go ahead.
Yeah, I'm sorry, 14% of what?
So remember, the penalty is 1% for every month that you did not have credible coverage.
But it's 1% of what? Your cost of, what is the?
So that's what I'm going to go into.
Okay.
Yes. So Medicare determines the amount of the average monthly premium for Medicare drug plans in the nation from the previous year. So it's a rate of $32. This year it's $32.74. That's like the average premium for a drug plan. That's what they use. So to calculate the monthly premium, you multiply the penalty percentage and the average monthly premium, and then you round it to the 10 cents. So for example, if you went 14 months without coverage, we take 14% times the $32.74. That equals $4.58. Okay. And then we round this to $4.60. And this amount would be added to your monthly premium for your drug plan. Does that make sense?
Kind of. I mean, I hear what you're saying, but who thinks of this stuff? It's kind of.
Yeah. So really, let's say your drug plan is like $15 a month, your Part D. Like you decide 14 months later to enroll, and you find a plan for $15. So, but since you didn't have credible coverage, you incur a penalty, which is 14. Based on our example, we went 14 months without coverage. Okay. And so we're charged 1% for every month of not having coverage based on the average premium, which is $32.74. And we determined the penalty is $4.58. And so they add that to the plan that you have. So let's say your Part D plan is $15. Now they add the $4.60.
Okay.
So now it's close to $20 now. So
Wow. Okay, thank you.
let's see. Now, Part D can be a little bit confusing because there's different stages of coverage. You have your deductible, if applicable. Not all plans have a deductible, but the max they're allowed to have is $505 as a deductible, some of these different insurance carriers. There is what's called the initial coverage period and a coverage gap and a catastrophic stage. And I'm going to go, okay, here's a breakdown, and then I'm going to show you an example. So in the deductible phase, the beneficiary is responsible for 100% of the retail cost for the drugs. Once that deductible is reached, they enter what's called the initial coverage threshold, where they split, they pay, it's either a copay that the beneficiary pays or co-insurance, and then the plan pays the difference, the balance remaining. Okay. Once that cost reaches $4,660, the retail cost, the beneficiary enters what's called the coverage gap. All right, which the threshold is $7,400. And it's a combination. So here, if it's a brand drug that the beneficiary is using, 70% of the manufacturers, the pharmacy discounts that cost. And the beneficiary pays the most during the stage, 25%. And then the plan pays 5% up until they reach this gap, 7,400. And this is what's called the true out-of-pocket costs. And there's two terms. I'm going to go, I'll pull up an example and I'll explain the example. And this might make it clear. It might not. Unfortunately, the government doesn't make this any easier. And this is actually going to go away. There's some changes taking place with the Inflation Reduction Act. They're trying to streamline this, and I'll go over some of those items as well as I go over this example. Let's see. I'm going to stop real quick. I'm going to pull up my example, and here. Sorry. Let me know if you can see my screen. Okay, perfect. So this is just an example of, let's say the medication, a brand name drug, and it costs $1,200 per month, okay? This is the retail cost. You have a copay of $80. We don't have a deductible. I took it out just to keep it simple. We have the initial coverage level, which is $4,660. And this section is related to the donut coverage, which, remember, I said the pharmacy discount is 70%, member pays 25%, and the plan pays 5%. And then we have this catastrophic coverage threshold, which is the true out-of-pocket, $7,400. And then the 5% that the beneficiary would pay. In this example, the beneficiary is paying $80 a month. Okay, this is out of pocket. The retail cost of the drug down here is $1,200. In the initial coverage, since the drug is $1,200, I highlighted this section here, the retail costs, and we notice here we enter the donut hole or the coverage gap, which is $4,500. The beneficiary didn't pay $4,800. What they paid is their copay, and they paid this blended rate once they entered the coverage gap. And I know it can get confusing here with the retail cost of the drug. But the thing, just so this is we're talking about two things here: out-of-pocket costs and the retail cost of the drugs, two separate things. So we're looking, once the retail cost of the drug gets into this donut gap, now up here, I was talking about 70% of the pharmacy, the drug manufacturer reduces the drug by 70%. The member pays 25% and the plan pays 5%. And this is kind of where you see the split happening. When the beneficiary enters the donut hole or coverage gap, we start looking at what's called the true out-of-pocket costs, which is a combination of the pharmacy discount, the member percentage that they pay, and the plan pays. All right. And down here, you'll see this running total. Okay. And this is the true out-of-pocket costs of the combination of the pharmacy, the plan, and the beneficiary. Up here, the beneficiary is paying this out of pocket on that drug. Okay. Once the true out-of-pocket expenses reaches close to that threshold I set up here, 7,400, the beneficiary enters into what's called catastrophic coverage. All right. And the member is still paying this amount out of pocket. But now that the true out-of-pocket costs have exceeded the threshold, now the expenses start to drop. The member is responsible for 5%, and the insurance carrier is paying the bulk of the cost.
Don, can you make that screen just a little bit larger? Do you have the ability to do that?
Yeah. Yeah. Let me see.
I think that's helpful.
Okay. Yeah, and this can, and not, the thing is not to get caught up with, because this can be really confusing looking at retail and looking at true out-of-pocket costs, because the definitions are completely different. I mean, this is what the pharmacy is charging retail. The true out-of-pocket is a combination of three things: the pharmacy discount, the member's payment, and then the plan payment as well. And up here would be the true out-of-pocket cost the member would pay for this drug, which would be $2,380. And so that, you know, I was just trying to highlight and kind of explain this, and I know it can be confusing. If anybody has any questions, I can see if I can try to explain it in a better terms.
Well, I think you captured it when you said it's confusing. So
Yeah, well, and this is the thing. And I'll see if I can. Let's see what's going to. You're going to see some major changes within the next. Pull this up. Let's see.
You said some major changes when? We didn't hear that.
Oh, sorry. So it's the changes that are coming. So in 2023, this after the Inflation Reduction Act was introduced,
yeah,
drug companies requires drug companies to pay rebates if drug prices rise faster than inflation. So what that means is they're trying to, the Inflation Act helped to price stabilize the drug costs. All right. Also, the more insulin savings program, they continue with that with $35 a month. Okay, those were some of the changes that were implemented in 2023. In 2024, the Act eliminates a 5% coinsurance for Part D catastrophic coverage. And so that's this section right here. The member won't have to pay the 5% related. This would actually come out to zero. And also they expanded the benefits for low-income subsidies for beneficiaries who are in the 150% federal poverty level. And then in 2025, they're going to bring on what's called the out-of-pocket cap in Part D drugs. So the highest will be is $2,000. And then in 2026, there's 10 drugs that Medicare is going to start to negotiate prices on. And then from there, the following year, they introduce another 15 drugs that they're going to start negotiating prices on in order to control costs. So they're going to eliminate this whole donut hole. And I'm surprised they went forever, so many years with this setup. It's very confusing and archaic. It seems like the only people that understand it is the pharmaceutical companies.
So I guess the real answer here is stay healthy and don't take drugs, right?
Yeah. Yeah. Oh, this is going to go away. They're eventually, but this is what it is currently. And so I wanted to kind of shed some light on it. So,
Okay, but it's going to go away.
all right, let me bring up my presentation. Okay. Okay. All right. Medicare Part C. So a lot of people, beneficiaries get confused with, sometimes they talk about Part A, Part B, Part C, Part D, and then there's Part C. All right. Just to clarify, your Part A and Part B is original Medicare, right? That's the government's health plan. All right. Part D refers to the drug, independent standalone prescription drug plan. Now, Part C is basically describes original Medicare has contracted with insurance companies to put together an insurance plan that covers Part A, Part B, all together. So they've pretty much, the government says, okay, insurance company, you're going to take care of insuring our beneficiaries under a Medicare Advantage plan. And what the Medicare Advantage plans, also known as Part C, include is, like I just mentioned, your original Medicare, A's and B's. It also, some of the Medicare Advantage plan has what's called the Part D, the prescription drug plan part of it. The nickname is also called MAPD. Also, these Medicare Advantage plans may include additional benefits like vision care, hearing. And in order to enroll into Medicare Advantage, you have to have your Part A and Part B, and you have to live in the plan service area. So that's why a lot of, when you enroll into plans, they ask for your zip code, because that's why they're able, as an insurance agent, I'm able to pull up plans within your service, your zip code area, or the county that you live in. All right.
Hey, Adon, so this may be more than you want to get into. How do they determine what zip codes are eligible for this?
Can you say that again?
Sorry, yeah. So you said that, part of the eligibility for Advantage or MAPD that includes the vision and the hearing and all that, you have to give them your zip code that's also a qualifier, right?
Well, they look at the service area. So yes, we ask for the zip code, the address. That way we determine what plans are in that area, in that location.
I see. Okay, thank you. Got it.
And here we talk about HMO versus the PPO. Okay. Both plan types. In order to be eligible, you must maintain Part B coverage. Some of the Medicare Advantages have a premium. It's either zero or low monthly premium. You have to pay co-pays or co-insurance for those services. There is a maximum out-of-pocket cost. If we go look at an HMO, if you decide you're in an HMO, you have to work within network providers. You have to go see your physician in order to see a specialist. And some of the plans are starting to change where you can go directly to the specialist as long as you stay within the plan's network. And then some of them are off. Some of these Medicare Advantage plans are offering no referrals. You're starting to see some changes now. They're trying to compete with the Medicare supplementals and trying to streamline the process. PPO plans, that gives you the flexibility to go in and out of network to see doctors. You don't have to have a primary care physicians, and it gets you the freedom to choose the doctor within the network. And so those are the differences between an HMO and a PPO. All right. So there's a couple of decisions to make in terms of Medicare. Your choice one, you have your original Medicare. Or you want to make sure you cover the gaps in coverage, you get a Medicare supplemental. And then you can add your standalone drug plan to that. The other choice, you can enroll in a Medicare Advantage Part C plan. You can choose a plan that has prescription coverage or not, or you can find one that has the direct plan included. So here's a breakdown of comparisons between the two if you're trying to decide. So in cost-wise, Medicare supplemental, you have to pay that Part B premium, which is $164.90. And plus you have to pay an additional premium for the Medicare supplemental. All right, with the Medicare Advantage, you do have to pay that Part B premium, but some plans don't have a premium. And if they do have a premium, it's really significant lower. It's a lower premium. You do have to pay copays or coinsurance to see your doctor, so it's based on use, as opposed to the supplemental. As long as you pay your premium, you can see any Medicare provider and not have to worry about the copays or coinsurance. Someone who would be a good fit for Medicare supplement is someone who's a frequent traveler. For them, it's important to see any doctor they want. They need to use many health services, and they can afford the premiums. A Medicare Advantage is someone who's probably doesn't travel that much. They're comfortable being in a narrow network. They don't have to go to the doctors that much, and they want to save money on premiums. All right. Drug coverage. With the Medicare supplemental, you can decide if you want the drug coverage or not. You have to get a separate prescription drug plan. With the Medicare Advantage, some plans are available with it or without. You have the choice. Okay. And if you need help, there's many programs available, and it depends on, some of these programs are tied to income and resources. So for example, Medicaid has programs that help with some of the costs. There is a Medicare savings program that helps pay for some of the premiums and deductibles, copays. And then the government has a program called Extra Help, and that helps pay for the prescription drug costs. And there's a state assistance programs in terms of for pharmacy as well. And sometimes the pharmaceutical companies have discounts on certain brand name medications as well. And that's something that you can reach out, talk to your provider about, or even go visit the websites for some of the different pharmaceutical companies. Okay. So when can you get started? So you can initially roll into Medicare. You've just turned 65. So it's 3 months before your 65th birthday, or the month of 65, and 3 months after you turn 65. All right. Each year there's an annual enrollment period from December 15th through December 7th. If you want to make changes to your plan. Outside annual enrollment, you have to have a qualifying event to make changes. And I'll go over some of those changes. If you move outside your planned service area, for example, you lived in Utah, Salt Lake City, and you moved to Phoenix, Arizona, you'd have to, that's a special qualifying event. You can make a change. Let's say if you're living in Mexico and you move back to the United States, that's a qualifying event. You move into and out of long-term care, that's a qualifying event as well. If you have traditional medical but want it as supplemental, that qualifies as a special event. If you were released from jail, that's a qualifying event. And then if you lost coverage from your employer, that's also a qualifying event as well. Here are some good resources to go visit. I tend to stick with Medicare.gov or Social Security. I know there's a ton of information out there, but these are the true sources to go to if you need information or details on certain specific plan details regarding Medicare. That's it. I know it's quite a bit of information. Maybe some of it you're quite familiar with, but if you have any questions, or even if they're outside of the scope of this presentation, I'd love to see if I can help answer them.
Hey, Adon, are you comfortable? We typically will share the slide deck with our guests. Are you
Yeah.
comfortable? Okay, okay.
Yeah.
Because I know some people were asking for your contact information in the chat to me, and we'll just be sure that they get this. Joyce sends out a link to the presentation so people can study this and have questions. You know, something that occurred to me is this is very, very complex. And I know sometimes when we go to the doctor's office and it seems to take forever, or you're thinking those people at the front desk or their billing department, they have to know all this stuff too. And it's, I mean,
Yeah.
it's just a lot. And so we sure appreciate the information that you've shared. I'm going to kind of study it again. I think that, you know, we've probably landed in the right slot for right now, but it was interesting to hear about the drug things too. So are there any questions from our guest today, or you want to put in the chat room, or if you want to raise your hand? Joyce is watching to see if you have any. What? Anyway. Oh, Betty, did you want to
Yeah, since we live in Maricopa County, which has excellent health care, thanks to our Len Kirshner, who was the head of AARP in Arizona for many years. I don't understand why people would take the Medicare plan versus an Advantage plan. I have all kinds of issues, pay nothing all year long for anything, except a minor copay for a COPD medication.
Yeah.
Because I'm in Maricopa County. So I find that a lot of people here at La Loma are changing, once they come to La Loma, are changing from their Medicare plan to an Advantage plan because they save $2,000 or $3,000 a year in doing that. There are some others who don't understand and they're afraid to make that change. With our contracts at Sun Health, many of the things that would have been covered by the plain Medicare are covered by those contracts when we go to the care center. So I'm just asking your opinion, why so many people stick with the old Medicare plan when the Medicare Advantage plans have come so far over the years?
Yeah, you're right. It's a good question. Probably a good example would be, for example, my father. He was very stubborn. He did not. To him, it was more about cost because he felt like he didn't want to pay for these extra benefits, and he said he didn't use them, and he didn't need to go see a doctor. And I remember, like, I would spend years trying to convince him, and he was just so adamant that to him it was about saving money, and he was fine with the original Medicare Part A and Part B. And eventually I was able to convince him to get into a supplemental, and this is prior, he had passed away a few years ago, but before that changed, he came down with cancer, and I was very fortunate to have him get the coverage that he needed because he was able to get the treatment up until the point. But otherwise, if he didn't have the coverage, it would have cost thousands of dollars in treatment. And I was very fortunate to convince him to get that additional coverage, so that way we didn't have to pay, out of pocket for all these treatments.
Right.
Yeah. Thank you. That's a good question.
Thank you.
So it's kind of a mindset, a personal preference and mindset, or as you said, stubbornness. People just default to where they're perhaps more comfortable because it is a complicated issue. And if you try to navigate those waters and try to understand it without the help of an expert like you, there's a lot to it, And I know that we have some members of our team who are looking out for their parents as well, just as you have, trying to guide them to make these good decisions. Actually, I think we have somebody's dad on this call today. So Joyce, yeah. So that was, Betty, that was a great question. Thank you. So we'll be sure to send this deck to everybody, and you'll have Adon's contact information here. He's very responsive, either email or phone call, and can really answer the questions in such a way that absolutely makes sense. And then he also stays up to date on everything. As he was talking about, the Inflation Reduction Act is going to impact some of these costs as well. So he's kind of your go-to guy on this stuff. So any other questions from our guests today? Joyce, do you see anybody? No? Okay. Okay. Well, think through it and be sure to reach out to Adon if you have questions. Adon, you did a great job. Thank you for dialing in today and sharing this, giving us a simplified version of a complicated topic. We really do appreciate that. So, I think that staying healthy also means staying informed and educated about things. We just have to stay on top of things. So again, thank you.
Thank you. Thank you for having me on.
You are most welcome. You are most welcome. So speaking of good health and speaking of well-being, as you know, we've been in the midst of this campaign, Generosity for Generations, and we're raising funds to support superior healthcare at our 2 hospitals and also to help fund our wellness programs as well. It's a very exciting time, and you'll be hearing some very exciting news in the future. We have some folks who are really stepping in and leaning into this campaign so that we all have access to superior healthcare and wellness. So stay tuned, because you're going to be hearing some great news. For the contributions that this community has made, we are truly so grateful for everything. So going forward, we have some wonderful coffees and other events coming up in February, and I know this is of great interest to many of you. Dr. Rodriguez, Hernandez, I just elevated your role there, Adon. Dr. Rodriguez, he really leans towards alternative and integrative healthcare, even though he's in kind of a traditional setting right here. And he's going to be talking to us February the 23rd, Zoom in. He happens to be my practitioner. I changed to him because of his the way he likes to walk the journey with his patient. He actually kind of lectured me and said that he was my partner and I needed to pay attention to what he had to say, and I needed to be honest with him. So good, a great healthcare partner, really enjoy him. In March, Dr. Andrew Chung, who's an orthopedic specialist, is going to be talking about our aching back. He is new to the scene. He was fascinated by the Sun Health story and was eager to share his knowledge. So be sure to dial into that. We've had some other suggested topics that will take us through the year also. So stay tuned as we kind of massage those topics and give some teeth to all of that. And then we're doing our Smart Giving workshops. We did 5 of those here in the Northwest Valley this past year, and we're taking them into the Southwest Valley, actually at Pebble Creek. And we have members of our Council of Professional Advisors who are making presentations in their areas of expertise. On Tuesday, January the 24th, in Pebble Creek at the Tuscany Falls Clubhouse, Daniel Esparza, a local attorney, is going to be talking about taxes and charities. And I saw his presentation. He sent us his PowerPoint. It's really very, very, very informative. And then in February on the 22nd, again, Michael Barnes, who is on our board, he is vice chair of our board actually, and works for Finemark National Bank and Trust. He's going to be talking about, are your plans in place, and don't leave things to chance. I know some of you have been to these Smart Giving workshops. I think it's worth hearing it a second time, because every time I hear these presentations, I learn something new. And then we'll move into March, again in Pebble Creek. A goal without a plan is just a wish. Mary Kavanaugh Marsh is new to our board. She is a financial advisor with Edward Jones, and she's in the Southwest Valley and has been in this line of work for 30 years and really, really is like Adon. She has a great way of taking a complex topic and sharing it in a simplified way. And then our 4th one in Pebble Creek is April the 13th. And Garrett Alexa with Jenny Strauss and Salmon Law Firm is going to be talking about making 2023 your best tax year ever. So you have a lot to learn with them. And then I'd like to also share that we are doing our 4th Golfing for Cancer event. And this is really a fun event. I am not a golfer, but I love Top Golf. It is so fun. So be sure to put this on your calendar too, to join us. It's just a great time. And you'll see that the proceeds from this event will support cancer treatments and support the whole cancer journey. And what we really enjoy about this event is that several of the MD Anderson cancer physicians come to this event, and they're worse golfers than I am. So it's really a lot of fun to see them at the event there. And they just love to talk to people, and many of their patients do show up. So it's always a fun event. And then we also, through our wellness program, Sun Health Wellness Program, this will be an outstanding presentation. Some of you may remember Jason Schechterly. He was a first responder who was critically burned many, many years ago. And he came out of that, and he's a motivational speaker and author. And he talks about how just how resiliency has really made him come through this. It's just a fascinating presentation. He's an author, a speaker, and I do hope that you will consider coming to this. Joyce, you can get more information by calling the number on the bottom of the screen, or all of you have Joyce's contact information. She can provide additional information for you as well. We really hope to see you at this May 3rd event, because really, really outstanding. So with that, I just want to say that, again, it's always so great to have all of you here. We're taking Coffee with Gina and Friends on the road. And so Betty, we'll be talking to you about bringing this to Loma. We're going to talk to our friends at Grandview, at the Heritage, at Royal Oaks, at the Colonnade, about really being on site to do this there. So it's convenient to dial in and Zoom in, and it's fun to get together in person. So kind of look for some of that information to bring your friends in. One more reminder about the little card that accompanied your little cookie. Please share this with friends and others who you know. We really like to get this information out to people as we certainly can. So again, feed your ideas to us, give us your feedback, stay in touch. And from all of us at Sun Health Foundation, and we speak for many in the community to thank you for your support. Everything you do in this community makes the world a much better place. So please stay well, stay safe, and stay connected. Thanks so much. We'll see you in February. Bye-bye. Thank you. Good to see you. Thanks. Bye-bye.